Health insurance. Everyone needs it, but it's so confusing, so many choices and new laws. If you need health insurance or have problems with your coverage, call us. The Office of the Healthcare Advocate helps you understand what insurance options you have, how to get health insurance, and to make sure you get covered for your medical needs. Call the Healthcare Advocate at 1-866-466-4446 or visit ct.gov/OHA. Trouble with English? We speak Spanish too.
Hi, I'm Vicki Beltry, and I'm Connecticut's Healthcare Advocate.
And I'm Jocelyn Memento. Welcome to Your Health Matters. Vicki, Connecticut's health is a big concern for you. What are your responsibilities as Healthcare Advocate?
Well, I actually have a lot of responsibilities. The Office of the Healthcare Advocate actually has a threefold mission, and it's to educate people about their insurance plans, tell them how to enroll in their plans. It's also to do pretty much what the bulk of the work we do is, which is to help them with problems that they have with their insurance plans, help them appeal a denial, a billing error, things like that. And the third role, which is becoming more and more prominent in our mission, is to engage in systemic advocacy. And that is to use kind of the data that we're seeing coming into our office and engaging in advocacy at systemic levels with the legislature, with the governor, with the federal government, to try to make sure that people are getting the coverage they're entitled to.
So basically what you're doing there is your liaison with all those agencies?
Yeah, we do a liaison type of role with the other agencies because we do work with them anyway when they send cases to us. But it's also to inform them of the problems we're seeing and to, in some cases, for lack of a better word, demand action to improve what's happening at those agencies to ensure people get their health care.
But what do you see as your primary role?
Oh, our primary role is to help people with their insurance problems. Put quite bluntly, that's the easiest way to say what we do. It's to take a call, help that person get what they need, take the next call, help that person get what they need.
And it's as easy as that, really, right? Picking up that phone call and taking whatever information there is from that person and start the ball rolling.
That's right. What we do is essentially people reach us in many different ways, actually. It's take that call, take that email, take that fax, communicate with that person who's trying to reach us, really find out why they're calling, get into a little more detail as to whether it's something as simple as referring them to the right place. We might not be the right place. If we're the right place, to explore the issues more, to kind of tease out what the real dilemma is that they're faced with. And then to be proactive in engaging them and their insurance company in making sure that they get the coverage that they're supposed to get under their health plan.
Not every state has a healthcare advocate, right? That's
right. Actually, how many are there today? Initially, we were one of only two in the entire country.
Basically, isn't the Healthcare Advocate Office in Connecticut, isn't it the one that really set the role for everybody else?
That's exactly right. So a couple years ago when this piece of legislation passed called the Affordable Care Act, which is the major piece of health reform that people talk about these days, there was a provision put in there to establish offices around the country like the Office of the Healthcare Advocate. It was really modeled on OHA. The Office of the Healthcare Advocate is often referred to as OHA. That's right. And Senator Dodd and Senator Rockefeller were very key in making that happen. So now there are more offices like ours around the country, but we're the most long-established office that there is.
And it was established for this very reason, because consumers really needed the help.
That's right. And it was established about 11 years ago now. I can't believe it's been 11 years, but it really was established in 1999 in our state laws because there was a real backlash. People were feeling like companies that were offering what we call managed care insurance plans, so HMOs type situations, were not really providing the care that they were promising that they were going to provide under the insurance policies. In fact, they were denying a lot of the care that was medically necessary. And really, legislators from both sides of the aisle felt very strongly there needed to be an office that would directly assist consumers to intervene with the health care plans to make sure consumers got what they needed.
And over the years, the staff has expanded. You have really highly trained staff to help folks who call in.
Yes, we do. Actually, our staff, as we speak, is expanding. We are probably going to be up to at least 20 people in the next month or so. And when I started back in 2006, there were 5 of us. So it just tells you how much we've expanded. But the staff is primarily clinically trained staff. So we have on staff a few RNs, nurse consultants, who come from various clinical backgrounds, whether it's mental health, pediatrics, OBGYN, geriatrics, and all of them bring their clinical expertise to the table when they argue for consumers with their healthcare plans. So they're able to use that lens that they have,
that expertise,
really that expertise they've developed over a long period of time to advocate for consumers. Now, in addition to the nurse consultants, we actually have on staff right now a licensed clinical social worker. That person is a master's prepared advocate who uses her social work expertise, her licensed clinical social work expertise, to help us advocate for mental health treatment that consumers who come into our
mental
office
health
need.
is such a big issue in our state. But let's talk about also your background. You're an attorney as well. That helps as with a lot of the issues that come up.
That's true. Actually, I'm an attorney, and we do have another attorney in our office, and it comes in quite handy because often there are cases that are they just don't fit that mold of a traditional advocacy type case that we do. So, for instance, we've had some cases where people have come in and they're facing a judgment from Superior Court against them for a hospital bill of, let's say, we had one that was $15,000.
That's happening a lot more than
right. And, you know, it really does kind of take the legal training to go in there, talk to the attorneys on the other side, clear up what happened. You know, in a couple of these cases, those judgments were really incorrect. They should never have happened. The information provided to the court was incomplete. So we had to go back, talk to the hospital in this one circumstance. And they actually pulled the judgment. They went back to court. They reopened the case, withdrew the judgment. Essentially what happened is that person did not owe that money anymore. And that really took a lawyer.
And all because they called the Healthcare Advocate's Office that they were able to get this help. All right, so how many people do you think you've helped over the years, and how successful is the office?
Well, we've helped tens of thousands of people. I ran the statistics recently, and we're up in the 30 to 35,000 people range. Now, that's just individuals who called. Many of those cases are really families that we've helped, so there might be 1 or 2 kids, 2 people, a husband and a wife that we've helped. So it's really more than that number. And we do measure our success. Obviously, the success is most measured and more accurately measured by the outcome. And did we help this person in one way or another? Did we get them an insurance policy? Did we overturn their denial? But another way we do measure our success is by how much we've saved consumers over the years. And as of last quarter, since the office's existence, we've saved $48 million for consumers.
That's amazing.
So we consider that a huge return on investment for the amount of money that's been budgeted for our office, which is really around $1 million a year.
$48 million.
Yeah, so we think it's an incredible attestation to the value of the office, and also to the fact that, wow, we really have a system that needs a lot of work. We shouldn't have to recover $48 million.
That's right.
So that's the kind of information that feeds into our systemic work to try to make the system function better.
It confirms the fact that the Healthcare Advocate's Office is needed. It's basically what that number shows,
That is
right?
true. That is true. It's the most direct measure, really, of
But you can't help everybody.
No, we can't. We can't help everybody. Obviously, the Connecticut has 3.5 million residents. We have a limited staff. So what we've tried to do over the years is really expand our outreach and education efforts through media efforts, through direct outreach to different communities around the state, underserved communities in particular, because we really feel like we're not reaching certain communities in the state, and we'd really like to reach those communities. So we've really exploded on our outreach efforts.
And real quick, let's talk about some of the issues. What's probably the biggest issue most people call about?
Well, the number one issue right now, you alluded to earlier, is mental health. That is the number one area of clinical complaint that we get. Unfortunately, that's been happening for a while now, so we are going to try to address that systemically in some fashion this year. But other than that, the biggest question that keeps coming to us is, I have a pre-existing condition and I can't find an insurance policy. What do I do?
And we're going to talk more about pre-existing conditions in a few minutes as well.
Right. So that's the second biggest issue probably coming into the office.
Among those who've been helped by the Healthcare Advocate's Office is a woman who was diagnosed with breast cancer. Let's listen to her story.
My name is Lynn Barron. I never imagined that I would have so much difficulty in dealing with not only the diagnosis, but the insurance company that I have and their non-payment of claims. I had a mammogram done, a routine, and it said that I had densities, and lo and behold, after the biopsy was done, is when their payment of claims came to a screeching halt. They said that I had a pre-existing condition. How could you possibly think you had a pre-existing condition of cancer in November, which is when I had the mammogram, and wait until February to do something about it? You'd have to be crazy. So, that just didn't make any sense to me. I got Golden Rule, my insurance company, after I had the mammogram, because it was a time when I needed to purchase a Cobra because I had been laid off. I finally realized that a mammogram had been done before I purchased the Golden Rule. So I thought to myself, well, that's got to be the red flag, because that ultimately led to the ultrasound. They didn't cover the mastectomies. They didn't cover the plastic surgeon reconstructive surgery. They didn't cover the anesthesiologist. They didn't cover follow-up. There was blood work. There was visiting nurse. Anything that happened after that biopsy, they were kicking back out. So I called the advocate's office, and I was so ecstatic. You couldn't have asked for a better place to soothe my wounds. Just a lovely person on the other end of the phone who said, "Tell me about it." And there was someone there to listen, and someone who said, "We're going to help you." She said, "We're going to go to the mat for you because this isn't right." They answered any question that I had, and if they didn't know it at that moment, they get off the phone and find out and call me right back. They emailed me and would send me copies of everything that they did on my behalf. It was incredible. I think it was only about a month. It was so exhilarating to go on the website and instead of seeing pending, I saw processed. I want people, if they have a situation they don't know what to do about, call the Healthcare Advocate's Office.
Lynn's issue was complex, Vicki. She was with a different insurance company when she had a mammogram that wasn't suspicious, but because she had dense breasts, her doctor wanted more testing. But by the time she received her breast cancer diagnosis, she was with a new insurance company. So how did your office tackle this one?
Lynn's case is unfortunately a very common type of case. OHA is very used to handling an investigation of this kind. As soon as Lynn called, one of our case managers, who really has a lot of clinical expertise in this area, she got right on this matter. She got to the insurance company, the new insurance company, and told them, "Hey, before you consider doing anything about this person's policy, I just want to let you know two things. A, we're involved, and B, we're going to make sure this person's policy is reinstated or stays as it is." So this case manager who has, like I said, a ton of clinical expertise when it comes to breast cancer, breast issues. She went right to the doctor who was involved in the case. She got the medical records from the doctor. She proved to that insurance company within a week of getting that case that this person should stay on her insurance policy, no questions asked. And that's what happened.
So Lynn won.
Lynn won.
All right, but how does someone decide that their case is really worth pursuing?
That's a very good question. And it's probably a very common reason that we don't get 20,000 calls a year as opposed to the 10,000 we get. What the general rule of thumb is, I think, is a person looks at an issue that they're facing, and if they feel either A, they're overwhelmed because of what they're going through medically, which is commonly the case. People fighting cancer, often people facing transplant situations. They don't have the energy to fight a health insurance company. They need someone on their side right away. Those kinds of cases, people just should call us directly. In a regular case, my general rule of thumb is to say, look, if you think you need help, you call us. Right. That's the easy answer.
And how important is it to save all that paperwork?
Oh boy, again, I use all these rules, but I think it's easy to remember for people if you use common rules. So most of us save our tax records for 7 years. I tell people to save their health records for 7 years.
That makes sense.
And I think it's important because you may think your situation is done. It may not be quite done. You know, insurance companies can look at claims even after they've been paid. Save your paperwork. That's the best advice I can give anybody.
By the time somebody calls you, are they pretty desperate?
Oh, usually most of the cases we get are people who are very desperate. You know, they're usually those kinds of situations that I just talked about where they have so many things going on in their life at once. Often it's the mother calling us for the kid who's in an acute care hospital with a mental health issue and she just doesn't know what to do. And she can call us and we will take that burden from her. There's no reason somebody going through a situation like that should have to take on the burden of fighting their health carrier. So that's our job. So I tell them, call us. So we tell the hospitals, tell your patients to call us. Hospitals call us, doctors call us. We will take that on.
Nuestras familias son muy importantes y nosotros como padres somos los mejores abogados de nuestros hijos. Si necesita ayuda, llame a la oficina del cuidado de la salud y no tome no como respuesta.
Our next story is with a woman who was dealing with a health issue linked to her pregnancy.
My name is Rachel Smith, and this is Billy, and we had difficulty with the health insurance companies from the very beginning. We had trouble conceiving, so my doctor sent us to a reproduction clinic, and we finally got pregnant. After the first try, we did an IUI, which is in vitro fertilization, and about 4 weeks into the pregnancy, I started to get really sick, and my doctor said, oh, I think you probably have hyperemesis gravidarum, which I always tell everyone sounds like the worst Harry Potter spell in the world, you know, but it means that you lose a certain percentage of your body weight and you can't keep down liquids or food. And right about when this started happening, I started having trouble with my insurance company, and I found out that my old job neglected to terminate my insurance coverage with them because I was currently covered with my husband's insurance. So every single healthcare provider I was seeing, and sometimes it would be 3 or 4 a week, would send me a bill saying that your health insurance company denied this, so you owe us $2,000 or whatever. And the fertility clinic payments were quite expensive. So I didn't know what to do. I was really upset. And one of my doctors said, you know, there's something called the Connecticut Office of the Healthcare Advocate. What they did was they kind of acted as a mediator between the health insurance company that I was covered under then and then the health insurance company that I had been covered under. And they were able to resolve all the claims. So it was wonderful. Once I gave them all of my information, they were able to connect the old healthcare insurance company with a new health insurance company and go through each claim. And there's a spreadsheet of about 4 pages of claims and resolve every one of them, which was so helpful because me trying to do it, I mean, I had like about 10 different healthcare providers and different claims for each one of them, and calling one insurance company and trying to work with the other, and it was just a mess. It was too tough. After I had the baby, I had another issue with the health insurance company. They denied my long-term disability coverage because they claimed that my hyperemesis gravidarum was a pre-existing condition. And that's impossible because you only get that condition if you're pregnant. So I contacted the Healthcare Advocate's office, and they resolved the issue for me, and the claim was reversed, which was wonderful. I would like people to know that the Healthcare Advocate's office is really, really helpful. They're friendly, they're professional, they're easy to work with. They know what to do, and most importantly, in my mind, they have the contacts that you need to get health insurance issues resolved.
Now, Vicki, with Rachel, you had to intervene with 2 insurance companies?
Yes, actually, Rachel had 2 policies, 2 insurance companies covering her at the same time. A very common situation. It's called coordination of benefits.
What does that mean?
That means so if you could have your own policy. You may be working, and so for instance, I'm working at the state. I have my own policy with the state of Connecticut. I may have a spouse who also has an insurance policy, but I may be on that person's insurance policy as the spouse. So when a medical issue arises, there are 2 insurance companies looking at that claim that a doctor files to decide which one is really the first one to pay and which one is the second.
So how do you clear things up for that?
It's a very complicated issue, as you know. So we have, again, the case managers that we have in our office just have faced this situation time and time again with clients. We have contacts at every one of the large insurance companies in Connecticut. And when we have an issue like this, we will go directly to those contacts and say, hey, you know, we have a case here. This person's covered by more than one policy. We strongly believe that you, carrier 1, are the carrier that has to pay first. You need to pay first. Then we'll go to carrier 2. Don't leave this person in the middle. Because what happened in Rachel's case was she had the 2 companies. One carrier paid, one insurance company paid. The other one then paid. So then the first one came back and said, well, if company 2 is going to pay, we're not going to pay.
Exactly. Why should we pay?
So they left Rachel with a big bill. And so our case manager was able to go in there and correct that situation for her. Coordination of benefits issues are extremely complicated. So those are the kinds of situations where I recommend somebody just call us because it's very difficult to iron out.
That's something that somebody could say to themselves, I just can't deal with this. I'm not even going to fight it.
Right, exactly. And that's what ends up happening, right? We think a lot of people do not get to us because they may have already decided, you know what, this is just a too difficult a fight to wage. So actually one of our outreach events, we addressed this issue specifically to try to encourage people to call us. Because believe it or not, there are a lot of people out there who have more than one policy and may not even know it in certain circumstances. So it's really important for them to get to us when a complicated issue.
So you put a lot of pressure on both insurance companies to get this situated.
Yes, we certainly do, because frankly, it's their job to pay. And
I like hearing that.
we say to them, look, this is a covered service. Nobody's questioning whether this person needed the service. Figure it out, but make sure that this patient is made whole. This person is held harmless, is what we say. So they don't have to pay out of pocket for a complicated issue that arose because they have more than one carrier.
Now, Rachel had another issue, her
Yes,
maternity leave.
She did. She had a very complicated case. And in fact, the case manager that worked on this case actually has a lot of expertise in OBGYN, so was able to use her medical expertise right off the bat to straighten this out. So Rachel was trying to get long-term disability to cover her while she was out on maternity leave. And her insurance company said, you know what? You went for some testing for infertility before you got pregnant. That's a pre-existing condition. We think you had a symptom of an illness before you got pregnant, so we're not going to cover you. Well, our case manager knows all about this condition that they were raising, or this pre-existing condition that the insurance company was saying this person had. And she went to the doctor, Rachel's doctor, and said, hey, do you think that Rachel could have possibly had this pre-existing condition? And the doctor said no. So our case manager went right to that insurance company and said, you are just dead wrong on this one. You're asserting that she has a pre-existing condition when she couldn't have had that pre-existing condition before she got pregnant, because it's medically impossible.
That's right. It was linked to her pregnancy.
It's really medically impossible. So you have to restore her long-term disability to the full length of the policy, which is 6 weeks.
And they did, right?
And they did. And they did. So in this case, this showed a couple things. One was the clinical expertise of the staff really made a difference for Rachel. And he was able to hop right on to this case as soon as she got it. And secondly, that our contacts with those companies make a difference, because we're able to get to them right away. Somebody who's working on their own case may not be able to reach the right people right away, but we can. So that's why we're there.
In both Lynn's and Rachel's stories, I'm hearing pre-existing condition. Is that a common MO among insurance companies?
Boy, is it ever. It's quite a common problem. I think, as I stated at the top of the show, pre-existing conditions are the reason a lot of people can't even buy an insurance policy today. That will change hopefully in a couple years. But right now, if you have a pre-existing condition and you want to go buy a policy on your own, if it's a condition that's a pretty serious condition, you're probably not going to get an insurance policy. And or if you're a little older and not quite of Medicare age, you're not going to get a policy. So it's about getting a policy, and then it's about once you're on the policy, what is the price of the policy going to be because you have that pre-existing condition. Sometimes people get on the policy and they find out, whoa, my premium's going to be $200 a month more. That's a big impact on people.
And something else people need to know, that you actually, your office does more than just insurance issues. You also expand on benefits.
Yes,
real quickly,
we do.
How do you explain that?
I'll try to be very quick on this. So one or two times we've had, or more than that, but we've had situations where people have benefits under their policy and they've exhausted them. So they have a limit on physical therapy of 20 visits, but they need it for a long-term reason, whether it's a surgery or something. We've been able to say to the insurance company, hey, look, this person has home health benefits. Why don't we borrow the home health benefit to pay for more physical therapy? And we've been able to do that for them and get coverage, so they've been able to continue their care and not lose any benefits under their policy at the same time. So it's very good bargaining power that we have as the OHA, but also the clinical expertise makes us able to do that for people.
That wraps it up for Your Health Matters. Thanks for joining us. And one last word from your healthcare advocate.
I know how important your health care is to you. Every day, I talk to people who are struggling to find health insurance or struggling to get their insurance plan to pay for what their insurance is supposed to pay for. You really should expect your coverage to be there when you need it. You're in the best position to be an advocate for yourself. When you think you need help, whether it's a very simple situation or a very complex situation, you just can call OHA and get the help you need. The most important thing to know, though, with your insurance company is they don't have the final say. You do. And how you exercise your final say is by not taking no for an answer. Pick up that phone, call OHA. We're here whenever you need us for any problem, no matter how big or how small. We have clinicians who have spent years working on health insurance issues, years in their clinical fields preparing to do this very work that we do. So do us a favor. Anytime you have a question or concern or problem, give me a call. I am your healthcare advocate.
Seguro médico. Todo lo necesitamos, pero es tan complicado. Si usted necesita seguro médico o tiene problemas con su cobertura y no sabe a quién acudir, llámenos. La Oficina del Cuidado de la Salud lo ayudará a entender cuáles son sus opciones de seguro, cómo obtenerlo y qué hacer para que todas sus necesidades médicas sean cubiertas. Llame a la Oficina del Cuidado de la Salud o visite ct.gov/OHA. Hablamos español.